Tamsulosin, also known under the brand name of Flomax, is a medication commonly prescribed to manage symptoms of an enlarged prostate. These medications can be effective in managing your symptoms, providing you use them correctly. There are some questions you'll probably want answered. So how and when should you take your Tamsulosin? When will the medication start working? How long will you need to take the medication for? And are there any side effects? This week we'll be answering the most frequent questions about your medication. My name is Dr Hart-Pinto, and at JHP Medical we make weekly information videos. So if you find this video helpful, subscribe, click the notification bell and the like button to support us in helping you. So what is Tamsulosin and how can it improve my prostate symptoms? Tamsulosin, or Flomax, is a medication that's commonly used to manage a condition called BPH. So first of all, we need to understand what is BPH and how this can affect our ability to pass urine. BPH is also known as benign prostatic hypertrophy. It's a condition that can affect men as they get older. Here, the prostate, which sits at the base of the bladder, enlarges, and muscle fibres which are present in the prostate can become tight, preventing the easy passage of urine from the bladder to your penis. Tamsulosin cleverly helps prevent this tightening. This is because Tamsulosin belongs to a group of medications called alpha blockers. They work by causing a relaxation of the muscle fibres that live in your urinary system. This action helps to improve the flow of urine and ease your symptoms. Are there any individuals who shouldn't use Tamsulosin? It's advisable to speak to your doctor if you suffer from any of the following problems. You've had a previous allergic reaction to this medication. You suffer from postural syncope, where you feel dizzy on standing due to a drop in your blood pressure, or those who experience micturition syncope, feeling dizzy after passing urine. This is because this type of medication may worsen your symptoms, increasing your risk of falls and subsequent injuries. It's probably best avoiding Tamsulosin if you have a history of severe liver problems, or you're planning to undergo cataract surgery because it is known to increase the risk of complications. Is it safe to take Tamsulosin with my current medications? Some medications can interact with Tamsulosin which lead to undesired effects. As previously mentioned, Tamsulosin can have a secondary effect of lowering your blood pressure. Therefore, it should be used with caution in those patients who are also taking antihypertensive medications, those which are used to help control high blood pressures. This includes other types of alpha blockers, such as doxazosin. This is because a further lowering of your blood pressure can increase your risk of complications. Therefore, you may need closer monitoring and dose adjustments made to your current blood pressure medication. We should also demonstrate caution when using Tamsulosin alongside erectile dysfunction medications such as sildenafil, Viagra, and tadalafil, Cialis. Again, this is not an exhaustive list. For more information, see the drug information leaflet that comes with your medications. So what is the correct dose of Tamsulosin? Tamsulosin comes as a 400 microgram tablet, something that you take once a day. How long does it take for Tamsulosin to work? Tamsulosin should start working soon after you take the medication. However, it may be several weeks before you reach the maximum effect. How should I take my Tamsulosin? It's best to take your Tamsulosin once a day in the morning. This ensures that the medication is working during the daytime. It's best to take your medication at the same time each day. Most people will choose to take it after breakfast or after the first meal of the day. Are there any foods I should avoid? Not really. Just try to take your medication after your first meal of the day. Can I drink alcohol with this medication? For most people, it's safe to take alcohol with Tamsulosin, but there are a minority that may experience symptoms of dizziness and even lightheadedness. If you're one of these people, it's probably best to avoid alcohol whilst taking this medication. I've missed my dose, what should I do? If you forget to take a single dose of medication, take it as soon as possible. However, if it's almost time for your next dose, skip the missed dose. Remember to take your next dose at the regular time. Please do not double the dose to make up for a missed one. I've accidentally taken too much medication. Overdosing on Tamsulosin can be dangerous. If you've taken too much of this medication, please seek urgent medical assessment. In overdose, Tamsulosin can slow the rate of your heart and cause a drop in your blood pressure. These actions can make individuals feel lightheaded and dizzy. How long will I need to take my medication for? If you're taking Tamsulosin to help manage urinary symptoms associated with an enlarged prostate, it's likely you'll need to take this medication lifelong. Stopping the medication is likely to cause a recurrence of your symptoms. Are there any side effects? The majority of those taking Tamsulosin will not experience any side effects. For the minority who do, you may find that they improve over time. The more frequently reported side effects are dizziness or lightheadedness, due to Tamsulosin's secondary effect on your blood pressure, ejaculatory dysfunction. This is where a man can experience difficulty with ejaculation. This can vary from only producing small amounts of semen to no semen whatsoever. Much less commonly, patients may report headaches, a stuffy nose or runny nose, palpitations where you feel your heart is racing, or dizziness on standing. Effects on your stomach and bowels leading to nausea and vomiting, constipation and even diarrhea. Occasionally, some people may experience some muscle weakness. Rare but concerning side effects can occur. If they do, please seek immediate medical assessment. Allergic reactions, the development of skin rashes, and episodes of collapse after taking the medication are all things to look out for. I hope this video supplied you with the answers you were looking for. Of course, this video does not provide individual medical advice and is intended for information purposes only. Do not consider this as a substitute for professional medical advice, diagnosis or treatment. Please do not ignore professional medical advice in seeking treatment because of something you've heard here. If you believe you may have a medical emergency, immediately call your doctor or ambulance service. Thank you for watching. See you next time. Bye bye.